studio on Awesome Radio 106.9 FM. We are here every Thursday from 3 to 3:30 on Family Health Matters. So glad to have all of you here with us on today. This is March National Nutrition Month. Have you been eating right all this month? We should be doing this all the time, but I have some guests here today that's going to remind us on how we can eat healthy, things that we should be looking for. And today we have named this National Nutrition Month, but Fuel for the Future. What we put in our bodies today is going to help us feel better for the future, for right now, for tomorrow, and for our future. I'm so excited to have with me Robin Tate. It's been a while since she's been here, but I'm so glad to have her back. And she is a licensed dietitian. She's also the director of the program director for the nutrition department, right? At the public health department.
Yes, Pitt County Health Department.
With her, our guest is Jessica. Cary, right? She's a ECU intern. Yay! Welcome, welcome.
Thank
So, Robin,
you.
we got so many things we want to talk about this morning, but I do want you to give you an opportunity just to tell our audience a little bit about yourself and just why this is so important to you. Of course, being a nutritionist, I know, but just to highlight a few things about yourself and what you do, and then maybe introduce Jessica to us a little bit.
All right. Well, my name is Robin Tant, and I work with Pitt County Health Department. I've been here over 15 years now, and nutrition has always been a passion for me. And I really love the topic of fuel for the future because it's not just about what we're doing now for our bodies, but it's for the future, whether that be, getting older or working with disease processes. There's so many things that go into it. And I have with me today Jessica Cary. She has graduated with a bachelor's in nutrition, and she is now doing her dietetic internship at ECU.
Welcome. Congratulations, Jessica. What are your plans for the future after you finish your intern?
I'll graduate in May with my master's and to
Okay.
be a dietitian, like Robin.
Okay. Okay. All right. Like Robin. Okay. Your mentor. Okay. Well, great. Great. So, congratulations to you again. Now, we have a lot of information that we want to cover on today. So I'm gonna not try not to talk as much, Robin. So if I'm talking too much, you say Wendy. So, but I do want us to get into our topic today: fuel for the future. And I know that healthy food and making healthy choices is what keeps us going and keeps us moving forward and keep us healthy. So I know that we have some objectives that we want to talk about, but tell us a little bit about just the topic fuel for the future.
So, Fuel for the Future, like I was saying earlier, is about sustaining healthy habits over time and looking for nutrient dense foods such as fruits, vegetables, whole grains, nuts, seeds, lean fish and poultry, and low fat or no fat dairy products. And so, making those choices throughout, the lifespan or life cycle. Can make us healthier, happier individuals as we age and develop. That's all important. But this year, the Academy of Nutrition and Dietetics campaign is Fuel for the Future, and it has several prongs. One of which is eat with the environment in mind. So some of the points around keep the environment in mind is enjoy more plant-based foods and snacks, and that can be just as easy as trying to eat from my plate, which is the campaign for getting fruits, vegetables, whole grains, and lean proteins into your meal plans. And or it can be just as simple as creating a meal for the week that is around beans. So making your meal around a bean product.
Okay. Okay. Eat with the environment in mind.
Mhm.
So let's maybe because you said that there were several objectives. So let's go ahead and list those objectives, and then
Okay.
maybe break them down and talk about them each individual as we go. But give us at the beginning so we'll know where we're going with this, and then hopefully our audience can follow us along and take some notes if somebody's out there with some pen and paper writing.
Awesome. Okay, like I said, the first one is it does have several prongs to it, but Fuel for the Future looks at eating with the environment in mind, staying nourished and saving money, eating a variety of nutrient dense foods from all of the food groups, and making tasty foods at home. And if you need more individualized care or nutrition education, working with a registered dietitian.
Okay. All righty. So those are the things that sort of like if we were in school, our objectives that we're going to talk about today. So starting with the you mentioned a little bit about the how to keep the environment, keep the environment in mind when you're eating. And you mentioned about the beans. So tell us a little bit more about plant-based food, because when we, you hear so much about eating plant-based diets. So tell us a little bit more and what does that look like?
So, getting more meals that include your non starchy vegetables, such as salads, tomatoes, cucumbers, squash, eggplant, things like that into your meal plans so that, you know, you're getting all that nutrient, all those nutrients dense foods, but you're also getting lots of vitamins and minerals as well as fiber back in your diet too.
Okay, so in depending on when we say plant based, we had to be specific or give an example of the good plants and maybe some not. I won't say bad, but maybe some not so good plants as far as like potatoes and things like that.
And it's not that you can't have those items, they just don't have all of the nutritions. For example, you use potato, you still can have a baked potato, but and it's going to have fiber. But say, for example, you eat a sweet potato, you're going to get more, vitamins such as vitamin A and fiber in that product.
Okay, and sweet potatoes. So what about peanut butter and beans? You mentioned beans, and
Yes.
is beans really truly more protein than hamburger?
Well, it's not more protein, but it's a different type of protein. So you can get protein in some of your beans, such as lentils, such as legumes, black eyed peas. There's just a plethora out there of different types of beans that you can get. Kidney beans that go with different meals. And when we talk about build your meal around beans, choose one of those that you really like and maybe pair it with something like a whole grain rice or whole grain couscous or even whole grain pasta. You can do it like that too, and maybe add some non-starchy vegetables like tomatoes or zucchini. There's so many different ways you can um, build around beans.
Mm-hmm. So replacing the ground beef with beans
Right.
is building it around. Okay,
And
okay.
this doesn't mean that you have to do that all the time, but
Mhm.
it's like, getting more of those types of food in your meal plan.
Okay, so having a taco instead of having the ground meat, use beans.
Absolutely. You could have
Oh,
beans in the taco.
okay.
That's another great example.
Okay, so we got to get creative.
Yes.
Okay, now we had talked earlier, and we had mentioned about we talked about environment. What about purchasing foods? When we're talking about not just what we eat, but the process of how we get those and how they're prepared.
Right. So in with this particular campaign, it's looking at, like I said, environment, keeping environment in mind. So pre or packaged foods, what that means is less plastic. So it is healthier for the environment.
Okay, so give us some examples of what do you mean by that? Less
So
plastic.
if you're growing your own produce, or those types of things, you're not going to need packaging. When
Mm-hmm.
you get your foods in the store, sometimes it's already packaged for you, so it decreases the amount of waste. You can also look at that like, when you're talking about packaging, and it doesn't really pertain necessarily in this component of it, but prepackaged or well, yeah, prepackaged foods are oftentimes also higher in like sodium and fat as well. So being mindful of that, but really it's the packaging and preserving our environment.
Okay. And you made a good point about food that you can grow yourself.
Hmm.
So, and I'm thinking that probably, shopping locally for tell us about farmers markets. Are they in season now? If I
So
was
right
looking for
now is
something.
great. They are getting geared up right now. They have been available the whole time, but this is prime time of the year when you can get the freshest, most colorful produce that's out there. And farmers markets are gearing up. Roadside stands. There's also community supported agriculture that which CSAs, which you can get your foods from as well. And you can grow your own garden. I mean, it can be as simple as a patio plant, like a tomatoes. What are they called? My goodness, cherry tomatoes. You can grow herbs like mint, basil that do very well on patios. And you can also have a small garden in your yard. You can make it as simple or as elaborate as you like.
So it's true that you can grow in a pot. You can grow
Hmm.
almost. I was told that anything that you can grow in the ground, you can grow it in a pot.
You can grow it in a container.
Oh well, thank you,
A
container.
pot container, both. It can be either. They have these cute little containers you can grow things in now, but a pot, you put some soil in it, and yep, there you go.
Okay, okay. So I can put me some pots or some containers on my patio and start my own little garden. So I don't have to have a plow and all that to do that. So what is the average what like with one or two plants like the tomato plants? Would that be pretty will that yield a nice harvest of tomatoes?
You really can do as you talking about on your patio.
Yeah. Uh-huh. If I was to do
Yeah, I would
something
say
just
so. You could grow some tomatoes. You could have a pot of tomatoes. Sometimes people do cucumbers. So it's kind of what you're looking for.
okay. So what vegetable is my favorite? I guess I could
Mhm.
put it
Absolutely.
in the container. So what are some vegetables that are in season right now? This is what March. So what's coming up and what's in season? If I
All right,
was
I'm
trying
gonna let Jessica take that one.
all right, Jessica, it's your turn.
So right now, we're more towards April's when you'll start to see fresher agriculture in North Carolina just because of the weather. But towards the end of March to the beginning of April, you'll see a lot of those leafy greens. So you'll start to see collards and spinach and broccoli's more of like a summer product. But early May, some turnips possibly and mushrooms. I saw those locally grown last year at the farmers market. So it's really starting to, once we get into the end of April, May, will be like the berries and the fruits more so.
Okay. Okay. So we should be able to find these fresh vegetables like the green leafy vegetables now at the farmers market or in the grocery stores that's considered locally.
Right. And then you'll start to see the squash and zucchini once it gets warmer too.
Oh, okay. All right. Well, let me shoot this one to you, Jessica. Put you on the spot a little bit. What now? Is it significantly different to have frozen vegetables versus fresh vegetables?
So there's not any nutrient difference in frozen and fresh if the frozen are just frozen, for example, like frozen broccoli in a bag. When you see things that say seasoning or seasoned, or maybe if they already say like air fried or lightly breaded, those things have been changed, obviously, the content. But fresh, frozen, canned, there's no nutrient difference if it's like in its natural juice or water.
Okay, that's good because I hadn't thought about the fact about if it has the breading or something on that means that it has been changed. But if
Mhm.
it's like corn that's frozen, fresh
Right.
frozen corn, that's just like fresh, actually fresh corn.
Right.
Yes.
You might have a taste different, and that's just the way it was, processed to
Mhm.
freeze. But
Okay, so they are just as good if something I wanted vegetable wise was not in season yet, but it
right,
was in the
that's the
freezer.
great one, and usually
So
a
that
cheaper option.
okay, all right. So better than canned.
No, frozen is the same as canned if it's for like natural. So if you see corn and it's just a can of corn, you'd notice on the back there might be a little bit of sodium in it, but you can get like green beans in their own juice or green beans in water. So you want to look for like lightly salted or no salt.
Oh,
And those
okay,
would be the
okay,
same.
And
okay,
another good rule of thumb that you can do if you're trying to reduce your sodium is just rinse it off.
okay,
Rinse the vegetables off if you do purchase canned.
okay. All right. So, but if I really had a choice of purchasing and I could purchase the frozen, well, fresh is always priority, then frozen, and then possibility can.
And it depends on what you're looking for and your lifestyle and what type of time you're putting into it. So all three are good options. I don't want to number them, but
Right.
it's really kind of what works for the individual.
Long as we're getting those vegetables in.
And that is the main part, yes.
Okay, get those vegetables in. Okay, all righty. Great. So we got that one. So we had talked about eating for the environment, being mindful. So now stay nourished and save money. Everybody wants to know that. So tell us about how we can manage. Everything is going up, expense, everything. So tell us how can we stay healthy and eat healthy, but even save money.
So one way, like you just noticed, is if you're in the grocery store and you want to add in those fruits and vegetables, the canned and frozen options are probably going to be cheaper right now this time of year in the winter, because the fresh options are not from this area, obviously. So they had to transport them here, more cost, higher gas money. Another way is looking in your pantry at home or your refrigerator, freezer before you grocery shop or before you make that list. So if you notice you have some beans or some corn or things in the pantry, maybe build one of your dinners that week around that, or make a soup that'll last you all week based on some you already have some ingredients at home
Oh, okay. Okay. So using what you have already before you go and purchase
before you
something.
purchase, and then always making a list and actually remembering to take the list to the grocery store is a good rule of thumb.
And I will say sales are great, but don't be like my husband who purchases 10 cans of corn on sale because that corn can end up sitting in your pantry. Use what you've got at home and you will save money.
Oh, that's you know what, and that's a good thing. That's a good point. I'm like your husband. You think it may seem like it's a sale, but really, if you don't use it and end up
Yes.
wasting it, then you've lost money. So, with that being said, I'm in the process of cleaning out my pantry now. Expiration dates, and I know this is a little bit off, but we're still talking about saving money. Now, if a can of vegetables, say corn, and it has an expiration date on it, can you still use that in a for a little longer than what the expiration date is? What is your thoughts on that?
I would say that if it says expired from for the general purposes of the program, I would say that it's expired. They also have something that says best used by. Now, if they say that, that just means that it's best used by, and so it may not necessarily be expired. But if it says expired, um,
Then it's exact.
then I would say it's expired.
Okay. All right. Because my children has this habit of coming in my house and looking in my refrigerator and looking to see what's expired or but I did see that on my on some cans that said, but it did say best used by. So there should be another date as well. So there should be an expiration date and a best used by date.
Well, not necessarily. If it may say best used by or expires in, so you would need to
Okay.
look at that label for that.
Okay. All righty. Okay. Good. That's a good point because sometimes you think that if you like you said your husband, if you buying all of this and you storing it up and you go buy it again, and if you don't use those ones that you bought earlier first, then you're going to end up with some
Right.
expirations going on. Okay.
And when
Good.
if you do have things like that, make sure you're doing like first in, first out. So use your oldest up first so that you do have more time with that product.
Okay, good. Good point. Good point. Okay, so that's save money. All right, eat a variety of nutrients, dense foods from all food groups. All right, talk to us about that. Tell us what that does. That go along with the My Plate?
It does. And so my plate is a wonderful tool for helping us visualize what a healthy, nutritious plate looks like. So we're looking at half of the plate being non-starchy vegetables, such as your tomatoes, your lettuce, your green beans, your asparagus, squash, those types of things, and fruits. And then the other half of the plate's going to be your lean protein and then your whole grain. So it's again a wonderful way to show balance and help visualize what a healthy plate does. So we want to get a variety from all of those food groups because that creates that balance of all those, those nutrients, those vitamins, those minerals. We need those each day. So we want to get a variety. If and like we talked about also, you can certainly do that with regard to, fresh, frozen, or canned. You can use that in that equation. And then if you see a diet or a promotion that says to exclude a certain food group, you would definitely want to consult with a registered dietitian because very likely that's not sound.
Ah, okay. So when you're looking at some diet plans, it should
Hmm.
include all of the food groups, so nothing should be
Yes.
totally restricted. Okay. So
If
what
it restricts it and cuts it out completely,
uh-huh.
likely that's not a sound plan because you need all of those nutrients and those food groups to have balance
Right.
and nourish your body and fuel your body for the
Yeah, because
future.
that's what talking about
Now and the
fuel.
future.
Mhm.
Yes.
Fuel in the future.
Hmm.
So those that diets that you see that's cutting out all your carbs, even though you need to be conscious of that and to see what's really the
Yes.
underlying process.
And that would be
Okay.
a great time, which is one of the prongs, to talk to a registered dietitian who can help you.
So how would somebody who's looking to get a registered dietitian, how would that work?
So we do have a list that we can provide to individuals, but you can contact your local health departments. You can contact your local hospitals. Most medical facilities have a registered a dietitian on hand. But just you reaching out to someone in the medical community, and like I said, there is a resource guide somewhere that we could put our hands on that I might can share with you. But that's how you would learn. There's also places that specialize in doing just that. That's
So
their business.
your primary care provider could also do that, right?
They
Your
can refer you out.
refer, yes.
Refer you as a referral.
Mhm.
Now, I know you depends on your insurance, but most insurance would cover that. Probably if it's referred to, but I mean, I know you have to look at your insurance policy to
Mhm.
see for sure, but at least it's worth looking into because some people shy from wanting to see a dietitian because they feel like it's not going to be covered in their insurance. So there's always something that you should ask your care provider,
Yes,
how does this work for you?
Yeah, that's what I was gonna say. Usually your doctor should know, and like if they refer to a certain place, that's usually a little better with insurance.
Okay, good, good. Because people sort of, hesitate to go to a specialist because they're
Mhm.
worried about insurance
right.
coverage. But I do like what you said that the health department could be a referral as well. I mean, a place that you could go to seek out in directions as far as what would be the next step if you really wanted to see a dietitian.
Absolutely.
Okay, so making tasty food at home. So we're all about family health matters. So tell us a little bit about the point how we can as a family can do better cooking at home.
Yes. So, one of the things that we always talk about is having your kids help in the kitchen, depending on their age, appropriate activity. But it can be as simple as letting them pick their favorite fruit or vegetable out for either the meal or the snack of the week. That's something that they can do. One great example, you had a great example in terms of a kid friendly idea
Oh yeah, the zucchini. So if the kid likes zucchini or you want to try something new, your kid likes spaghetti. Maybe instead of noodles, you take out the center of the zucchini, and you can either add it back into like your sauce and ground meat, or if you're using turkey or whatever it is, and then you just put it back in the zucchini like a little boat. And you can put cheese on top, and it's like a little zucchini boat.
Oh, that is cute. Okay, that's good. Good.
And also, another thing to consider is how you're using your leftovers. So sometimes leftovers are just what it sounds like. You have, the same meal for the next night, and it's a tasty food. But even if you have extra ingredients from something you're preparing, I think one of our examples was like if you like baked or grilled chicken, you could use it in a quesadilla. You could use it in soups. You could use it in a salad. So there's different ways to use things. Same for beans. If you have extra beans that you didn't use, same thing goes for them. They can be added to those things as well.
All right. So utilizing all your resources and pulling the family in and probably looking at recipes,
Yes.
allowing the children to find a recipe that they want to try and just
Yes.
give it a shot. Or even looking at Facebook and finding, I've seen some really neat recipes on Facebook as well to
There's
try.
some wonderful recipes, and children love to measure out things. And I did want to let you all know about an event that we've got coming up that
Yes.
that does some of just that. We are super excited. It's called Fuel for the Future Community Event. It will be this Saturday, March 18th, from 11 a.m. to 2 p.m. It will be at AmeriHealth, which is located on 1876 West Arlington Boulevard. And if you don't know where that is, it's kind of where K&W used to be. It's right in the back, though. We will have our WIC van there, and we'll have signs so people can see. But the great thing about this is, going back to your recipe idea, Wendy, is that we are going to be making kid-friendly tostados, and they will get to kind of make their own and choose their own ingredients. There will be stations there that highlight the different food groups, and there will be fun games, activities for the children, and there will be door prizes. So we hope that we're doing this in conjunction with our WIC program is doing this in conjunction with AmeriHealth. So we are super excited, and we would love people to come by for totally, for families and either WIC participants,
Okay.
participants,
We,
or
we got to
families.
go, Robin. It's time
Okay.
to go. This has been so great. But I'm your host, Wendy Bridges, and we are here every Thursday on Family Health Matters on Awesome Radio 106.9 FM. Thank you, Robin and Jessica,
Thank
for
you.
being here with us. Have a great day, everybody. Thank you for joining in.
Thank you.
Your inspiration station for the family.
Bye, everybody.
Awesome Radio.
Partial funding for this program is brought to you by